Welcome to This Medical Life podcast. These are the stories of medicine with Steve Davis and Dr. Travis Brown.
This is a story of vitamin B6. Mr. Steve Davis.
Yes.
Can I ask you a question?
I'm nervous.
No, it's okay. Do you take, you're doing all your gym, you're doing everything right at the moment and looking well. Do you take vitamin supplements?
No, magnesium's not a vitamin. So I take a little bit of magnesium and that is about it.
Oh, okay. Do you know what's in the magnesium?
I'm hoping magnesium. It's a salt. It'll be a salt-based thing, I would have thought.
Could there be anything else?
I don't know. They're right here in front of me.
Oh, are they?
It's got in it, it doesn't really say. It just says, go forth in faith. Each capsule, magnesium glycinate, magnesium itself, magnesium amino acid chelate, and that's it.
Oh, okay. Well, interesting. Well, look, you're not alone because when we look at supplements, now supplements, do you consider supplements a medication?
Only if prescribed by a doctor.
Okay.
I'm taking it myself because I've heard through the gym that it's a good thing to do. So I know I'm partially in the woo area and a lot of this is enriching my urine, but I'm going with it.
Now, if a doctor was to say, are you on any medications, would you say magnesium?
No, I wouldn't.
Right. And so we're actually looking at this from a supplements point of view. And about a third of Australians take supplements, about a bit over a quarter of New Zealanders, around a half of the United States, and about a bit between a third and a quarter of people in the UK actually take supplements. So it's not uncommon. Mm-hmm. And there's a whole sort of array of epidemiology and demographics about who takes them. Tends to be a little bit more affluent, there is even race disparities about who takes supplements. But there was a presentation that I went to, it was at a conference by chemical pathologist Dr Gemma Daly, and she presented a case of vitamin B6 toxicity. And this is a rare but important condition for doctors to be aware of. And it's particularly in the era of supplements, over-the-counter medications, internet supplements, fad diets, as well as food additives, sports and energy drinks.
Don't look at me when you say fad diets.
And so this is actually, supplements are a multi-billion-dollar industry. And it fits into this unusual category of not a medication. As you said, you don't actually think of it as a medication.
No.
And people will not actually say, when you say, what medications are you on? I'm taking supplements.
I'm worried now that it could actually be interfering with some of the medication I am on.
Well, look, it's one of those things. And there was recently an article in newsGP, and it was called I Couldn't Walk, a GP's personal story of vitamin B6 toxicity. Now, this was a GP who suffered from genetic restless leg syndrome and had cramps and paresthesia, and this was getting progressively worse. And her pharmacist actually said, take these magnesium tablets, they will help you with the cramps. And she did. Now, over the next few years, her health deteriorated.
I noticed a slight reduction of strength in upper leg muscles and in my glutes. Then there was a continuous, slow deterioration of muscle strength. Then I couldn't walk. I was getting to where about 100 metres was a struggle. I used to go to the tennis and the footy, but I haven't done that for the last year now because walking a distance and going up and down stairs is just impossible.
She went to see a neurologist, had a full assessment and examination and workup, and was ended up diagnosed with vitamin B6 toxicity. again, wasn't taking vitamin B6 that she was aware of, but this was an additive in her magnesium tablets, supplements that she was taking. This being this medical life, I look back in the literature,
Yes.
and the first reported case of this I could find was from 1983, and this was in the New England Journal of Medicine.
A 27-year-old woman sought medical attention because of increased difficulty in walking. Approximately 2 years previously, she'd been told that vitamin B6 provided a natural way to get rid of water. She had begun to take 500 milligrams per day. 1 year before presentation, she reached a daily intake of 5 grams per day. She initially noticed that flexing her neck produced a tingling sensation down the neck and into the legs and soles of her feet. In the 4 months before neurological evaluation, she became progressively unsteady when walking and noticed difficulty handling small objects. Examination showed that the patient could walk only with the assistance of a cane. Her gait was broad-based and stamping, and she was unable to walk at all with her eyes closed. Her muscle strength was normal. All limb reflexes were absent. Babinski signs were not present. The sensations of touch, temperature, pinprick, vibration, and joint position were severely impaired in both the upper and lower limbs.
These symptoms are essentially a neurodegenerative disease. And so you end up having these full investigations of a neurological examination, lumbar puncture. You have patient had no family history, bloods including toxic screen, metabolic, immunological. Like, you're talking the full gamut of tests. And this is to rule out other causes because neurodegenerative diseases are so devastating. And you're looking at the doses of these patients, though. And the amazing thing is this report detailed 7 patients, all young, so between the ages of 20 and 43. And they had started taking these large doses. They ended up being anywhere between 2 to 6 grams. So we're talking about milligrams. These people are talking about grams.
I know. That's heavy duty.
And 4 out of the 7 actually started getting symptoms 2 to 4 months after taking this large dose. So you're dose dependent, that's fine. The treatment was to stop taking the supplement, but recovery from this is variable.
Approximately 2 months after withdrawal from vitamin B6, the patient reported the beginning of improvement in gait and sensation. 7 months after withdrawal, she felt much improved. She could walk steadily without a cane, could stand with her eyes closed, and had returned to work. However, her strength remained still normal, but tendon reflexes remained absent throughout. Her feet still had a severe loss of vibration sensation, but definite improvement in the sense of joint position, touch, temperature, and pinprick. In the upper limbs, there was only a mild impairment of vibration sensation.
I need to emphasize this is rare, but it is important because, again, if it's not considered, you're going to go down the neurodegenerative type path. And there are other cases in the media and literature that come up from time to time. There was an 86-year-old who was a very well person, started taking Mega B supplements. After routine blood tests said he was a bit deficient in vitamin B. But over the course of some time, he ended up losing his ability to walk, went to hospital and was in hospital for 9 weeks having examinations and trying to find out the cause. Turned out to be vitamin B6 toxicity. There's even a 40-year-old gym enthusiast because this is, again, an area that people say, we'll take it. It's not that bad. It'll help.
I'm a textbook example here.
And this is this 40-year-old gentleman. He ended up he started getting 8 months of muscle twitching, which increased with frequency and intensity. It moved down his limbs, his trunk, his neck, his face. He got abdominal cramps and even had this burning sensation in his feet. Again, who went through the full gamut of a neurodegenerative disease investigation. And look, we've now gotten to the point where this happens. It is rare, but it happens enough that the TGA in 2022 started saying that, okay, anything over 10 milligrams of vitamin B6 needs to have a warning on it of peripheral neuropathy. Now, yours actually looks like it probably doesn't have it in it, but there's a lot that do. There will be magnesium tablets that actually have it in it, but they'll have a warning. And as you said, I've never really read supplements on the back, but it's in a little fine writing, but it is still there. But there's over 1,000 medications in Australia that contain vitamin B6. And so it's also present now in energy drinks, breakfast cereals, protein drinks, and weight loss shakes. So I've had doctors call up and say, hey, I've got a really high vitamin B6, but the patient is not taking anything.
They're just getting it from other sources incidentally. That
we're not aware of. And so this is a problem that is important to be aware of, and something we're going to talk about a little bit more with our guests coming up.
And just to err on the side of caution, I'm taking these. I'm just tossing that just to be safe. Dr David Kanowski is a senior chemical pathologist at Sullivan Nicolaides Pathology, where he works in clinical chemistry, endocrinology and toxicology. Dr Kanowski first studied science at the University of Queensland and graduated from UQ School of Medicine. He trained in Queensland and overseas. He joined SNP in 1997, where he's been instrumental in introducing new technologies and tests. Dr Kanowski is widely published and presents at Australian Association of Clinical Biochemists and the Royal College of Pathologists of Australasia, and he is our guest on This Medical Life. David, welcome.
Thank you.
David, I was looking through my pantry. I couldn't find much in the way of liver. There was a little tin of salmon in the pantry, and I guess they've got some vitamin B6 in them, but where do we get our natural sources of this vitamin?
Yes, well, sure. As you've said, the meats, particularly the organ meats like liver, etc., are quite high in B6. But interestingly, starchy vegetables are also very high. In fact, the highest level is found in chickpeas. So there's plenty around. And also dietary vitamin B6 is found in a lot of cereals are fortified with multivitamins. The only ones that don't have much B6 are citrus fruits, but the rest of the vegetables and fruits contain a fair amount of B6. So there's no real shortage for the general population. Deficiency is unusual.
Just looking at vitamin B6 in itself and what does it do in our bodies?
It's very broad, the role it plays. It's actually involved in more than 100 different enzyme reactions, where it acts as a cofactor bound to the enzyme. It mostly are concerned with protein metabolism, but it also has a very important role in the synthesis of neurotransmitters and also in maintaining and forming homocysteine, which is an important amino acid as well. It has lesser roles, but it is involved in gluconeogenesis and glycogen breakdown, and also has a role in some of the interleukins. So immune function, interleukin-2 involves B6. So it is very widespread, its function. But
this seems to be something that gym junkies and everything sort of lead into. Is there any reason why you think, like just from a personal perspective, as to why that might be the case?
Look, I'm not entirely sure why that is the case. It's certainly in a lot of sports drinks and supplements, and also the energy drinks like Red Bull, etc. They also contain a significant level of those things. I think it was supposed to possibly help with sports function, muscle function, but there's no real evidence for that. But it's well known that it exists in a lot of these supplements.
You mentioned that there's not a lot of deficiency in the general community because of where it is.
Yes.
Who is at risk of B6 vitamin deficiency?
Yes, look, isolated B6 deficiency is unusual, but it may be seen, usually associated with low concentrations of the other B complex vitamins. People with impaired renal function, like people in renal failure on dialysis, can be prone to broad B vitamin deficiencies. And the other large group is autoimmune disorders. It seems to be that it's chewed up a little bit when people have inflammatory conditions and cytokines are produced because it's involved in that role. So things like rheumatoid arthritis, it can occur, but also in any of the autoimmune disorders which cause malabsorption, because in general, malabsorptive disorders overall result in lowish levels of the B vitamins. And conditions where this has been made by medical intervention, such as gastric bypass, vitamin supplementation is done, and mineral supplementation is commonly done post-gastric bypass.
What symptoms would they present with?
The classical literature, it's rarely seen, but it's typical of some of the more general B vitamin deficiencies, where you get a dermatitis with chelosis, scaling of the lips and cracks at the corner of the mouth. You may see, if it's more marked, a degree of anemia, a microcytic anemia, and the tongue swelling, glossitis, and then weakened immune function because of its immune role. In some more severe levels, you can also get mental status changes like EEG abnormalities and even seizures, depression, confusion. That would be extreme, and I think pretty rarely. I've never seen it clinically, but it's possible, certainly.
What foods and supplements are actually having vitamin B6 added to it?
The one thing that's more, I think the major group that we see in Australia is in cereals, breakfast cereals, where they have it added. The main issue is in supplements, basically. We get it in all the sports drinks, as mentioned earlier. Energy drinks have significant amounts. And vitamin B6 is found added with some other supplements, such as mineral supplements, particularly magnesium supplements. So it's across a broad range of health supplements, and the multivitamin ones can contain megavitamin levels, immune boost function, some of them are called. So that would be the spectrum of foods and supplements where we see that.
David, do we need to have it added, particularly to the cereals, given the abundant presence of B6 in many foodstuffs? Because I remember in the very early days, showing my age now, there were ads for, I think it was cornflakes or something, and the whole ad was niacin, riboflavin, B6, blah, blah, blah.
Yes. The answer is really no. There's no evidence that in the general population that there is any concern. The vitamins which are reasonable to add are for people who have got, problems such as, high alcohol intake, where we get thiamine added to bread, folate is added to some things because pregnant women, it's important. And if they're not taking supplements from their doctor, then, so those two are probably important in general, but the rest of the B vitamins, really, there's no evidence that they're, unless you have a specific problem, such as pernicious anemia, where B12 will be used. Overall, no, there is no obvious role for them, really.
Where's the most surprising place that we've actually found vitamin B6 that doctors and patients may not be aware of?
Well, the real hidden one was the story about magnesium supplements. Many patients have taken magnesium, most commonly for cramps, because it was recommended for nocturnal cramps. And on the front, we would just say magnesium and the dosage. And on the back, if you look very closely, you may see that it had pyridoxine, or B6, which is the form is present in pyridoxine. But it sometimes wasn't even listed. I believe it was in there because there was some thought that it could help with nerve function, because deficiency could cause nerve symptoms. But also the magnesium is quite difficult to solubilize. It's not that soluble. Some magnesium salts, like mag sulfate, Epsom salts, they're hard to dissolve. So pyridoxine was an agent that allowed it to be easily solubilized. And I think that's probably the main reason why companies put it in there, is that it really helped to get the magnesium into the system. So it was a hidden factor, really. And most people, when this cropped up sort of 5 to 10 years ago, when I talked to doctors, they'd say, oh, no, they're just on magnesium. So, when we do tests and see levels that were, really surprising. So I would say that's the major area. The other thing is sports drinks, and some people just drink them all day. But the levels tend to be not as high as you've got with magnesium. So those would be the two factors most important, I would think.
At the start of this episode, we discussed the article that recently came out. The GP who developed severe toxicity symptoms stated, I couldn't walk.
Yes, I read that one.
Yeah. Is this something we're seeing more and more?
Median B6 levels, we've plotted them when we were looking into some research for a paper that one of our doctors, Dr Gemma Daly, published in the Australian Medical Journal. We went through some of our data and we found that the median B6 levels in Australia have been rising consistently as far back as we could measure testing it. So up until 2020, which was about the last time we downloaded the data, they consistently rose up to a level approaching, around about 200 nanomoles, where the recommended daily levels are up to around 100. So even the median population of people that we're testing was well above what was considered a recommended range for the vitamin. So it's something that has certainly come, and doctors are starting to become aware of patients showing up with a neuropathy or peripheral neuropathy, that one of the things they should definitely test, apart from all the usual things, is B6 or pyridoxine levels. But that's only become generally aware in the last few years, really.
What are the typical symptoms that someone will present with toxicity, and also what is the toxicity level that we sort of GPs, when they test, look at and say this is actually toxic level?
Well, there have been a couple of papers in the literature, and the one that we quote talked about a level around 250 nanomoles plus as being potentially toxic, although some patients have now been reported above 200 to have symptoms. It seems to be very variable, and some patients can have levels of 400 or 500 and complain of no symptoms at all. So there is also in the literature articles that discuss this variability, and it seems to be that there are unique susceptibilities in some people to lower levels, and others can cope with higher levels. And it may well just be their enzyme function and the fact that pathways are blocked in some individuals earlier than others. But so, I mean, the presenting thing is typically this peripheral neuropathy, a sensory neuropathy, glove stocking type effect. But there may also be, in severe cases, disequilibrium, I believe, like the case you presented, where you get ataxia, weakness, and you can even get bone pain, fasciculations. That'd be the spectrum that we have heard reported, yes.
At the beginning of this episode, David, Dr. Travis Brown took me by surprise, asking me what supplements I take, and I actually do take magnesium. However, here's my dilemma. I've been brought up to believe that, look, in this Western world, we take too many vitamin supplements, but it's okay. It just enriches our urine and it disappears. Vitamin B being water-soluble, I would have just expected we would get rid of excess, no harm, no foul. So why and how is the toxicity showing up in patients when it is water-soluble?
The thing about B6, and no one knows for sure why this is, but certainly the half-life of excretion is quite a bit longer than other B vitamins, and it seems to be anywhere from 2 to 4 weeks, depending on the individual. Why this is the case, we're not sure, but it seems to be that unlike other B vitamins, the vitamer, the precursor pyridoxine, which is converted to the active form, which is pyridoxal phosphate, pyridoxine actually at high levels can interfere with that conversion. And it can also interfere with the enzymes that excrete pyridoxal phosphate because things are broken down. So it seems like it's quite unusual, but the precursor vitamin at high enough levels starts to develop and produce symptoms which are very much like the deficiency state because it interferes with the function of the active vitamin. And that seems to be the reason. I mean, the literature is just starting to come out on this now. So that's the latest theory, but it's not proven as yet, really.
A lot of people are taking supplements, and vitamin B6 toxicity is still rare. But talking to doctors, who would you actually consider testing for B6?
I would think really that the major thing is people presenting with peripheral neuropathy or claiming to have burning feet, symptoms in the feet, because often those people will have sought out magnesium to try and help with their leg symptoms, because that's the common out there in the general literature, is that magnesium may help you with your problems. I mean, if patients complain of other symptoms, well, unsteadiness, ataxia, sure, but I mean, that's an extreme symptom with B6, and it's not seen until doses are very high or exposure is quite prolonged. So I think basically peripheral neuropathy, it should be on the list of things to look for, because it's reversible, and mostly reversible anyhow. So it's an important thing to consider.
I'm just wondering about the gym junkies that come in who are healthy, who are sort of having every supplement. Do you end up saying, look, this might be worth screening just to see, or is that probably not?
Oh, look, I think that's reasonable. I mean, it's not an expensive test. It's not right up there. It's the same sort of cost as all the other vitamins. So it's not really a big impost on the health system. And if it produces symptomatology and problems that are, potentially interfere with lifestyle, I think it's worth, that's certainly a group where you may consider it as well.
Now, there were rule changes for the supplements to go in from the TGA. Do you think that that's an effective method for this?
Yeah, look, it's a start. I think definitely. I mean, it used to be that the supplements were allowed to have up to 200 milligrams, which is huge. The recent TGA thing has said 100 is the max you can put in anything. And also you have to have now a warning when there's more than 10 milligrams in the preparation. Previously it was 50 before. And if you're taking 50 a day, it's very likely that long-term you'll get into complications. So their advice now is probably good. Unfortunately, it's still quite small and usually on the back of the bottle. So I think there's probably been pushback from the people who make it to say we don't want to plaster this all over our product. But it is there. And it's out there, and I think doctors and general practitioners are now becoming aware of it. So we still see people who are surprised when we tell them to check, B6 because they've been taking magnesium. But I think it's becoming much more mainstream now. So it's well worth promoting this because, it potentially is a cause of harm to patients.
When this gets tested, is there any instructions for patients that they need to do for having this tested?
Yeah, like most of the vitamins, because they come through in a large surge and then they levels drop, it's probably better to come in fasting. We recommend that. And even more, stop your supplement for the day before so we get an idea of the background level. The peak goes fairly quickly and you get the background level by the next day, so that's fine. We take precautions when we do this. Like several vitamins, it's sensitive to light. And so ideally, we ask our collectors to wrap it in foil or put it in a paper bag. It doesn't drop off a lot, but it will start to drop, and over a couple of days, 10, 20% levels fall. If you've got severe toxicity, it will still show up as high, but to protect it from light is important, basically. That's our major concern. And also, as I said, that they should come in fasting.
Now, these patients are clearly not just taking vitamin B6. Is there any other vitamins that fall into this category of potentially becoming either dangerous or collect in the body that would be useful to know about?
With the B vitamins, this is pretty much it as far as we're aware. I mean, the other ones, people take huge amounts of B12 and it doesn't seem to cause them problems. Folate as well. Some of the other ones, as you said, B1, B2, thiamine, riboflavin, not an issue. The other ones that would be concerning are the fat soluble. So vitamin A and D can cause problems if taken in huge amounts. Vitamin D is not so much, but you can get hypercalcemia with that. Vitamin A, certainly in high levels, you can get, you push your calcium right up to levels where it starts to cause toxicity. So those are only the other two that I would be concerned about clinically.
I really feel like this is an ambush because the only other supplement I have in front of us is vitamin D. David, are you and Travis working together on this?
Not specifically.
This is an intervention, Steve.
Yes. David, just finally, have you got some thoughts or advice for clinicians about vitamin B6?
Well, nothing specific, more just to keep in the back of your mind with a patient with peripheral symptoms, burning, numbness, peripheral neuropathy type symptoms, that you really should check for B6 definitely these days. That'd be the bottom line, I would think.
And the silver lining for me is, having done my research on what foodstuffs have high natural sources, I don't have to learn how to eat liver and lamb's fry because I'm probably getting enough with my general diet. Is that fair to say?
Absolutely, yeah. The starchy standard vegetables are fine, so there's no concern there at all, really.
All right, I'll pop some spuds on. David, thank you so much for joining us on This Medical Life.
Not a problem. You're welcome.
This Medical Life is recorded in the Talked About Marketing Studios in Adelaide. For show notes and more information about the podcast, visit thismedicallife.com.au. You can contact the hosts on social media. Dr. Travis Brown can be found on X. His username is @Dr. Travis Brown. That's Dr. Travis Brown. And Steve Davis can be found on LinkedIn. Go to linkedin.com/in/TheRealSteveDavis. This has been a PathNotes Proprietary Limited production.